Nous sommes heureux de vous accueillir pour cette nouvelle session d'après-midi qui va être passionnante parce que plusieurs équipes vont venir nous expliquer comment elles agissent au quotidien pour le confort de l'enfant, respecter ses droits et des témoignages d'équipe.
We will have teams talking to us as well as experts. So it's going to be just brilliant. With Céline, we are delighted to moderate this session. My name is Elisabeth Fournier-Charrière. I'm a pediatric pain specialist. I worked in public hospitals in Paris and with Pédiadol. So we are delighted to be here with you today. My name is Céline Guillou, and I'm a Senior Health Executive, Medical and Surgical Specialties Unit in Lille University, and I'm working with Trousseau, and I work with Sparadrap and Pédiadol. That's why I'm lucky to be here to moderate the session with Elisabeth. Thank you. Well, good afternoon, everyone. Sit down, relax, and I hope you had a good meal. Yes? Did you have a good meal? Come on, louder. That's it. I love that energy. You sound almost like people from Brittany, les Bretons. I see some hands. I know we know each other. I'm really delighted to be invited for this game today because I have a lot of people from pediatrics, so we have plenty of players here with me. So I'm from Rennes, and I work in the university hospital over there. So I don't know you, and I don't know where you come from. And those of you who are from hospitals like me, please stand. Right. So there's a lot of you from public hospitals. Thank you. Anyone working in private practice clinics? Some of you, yes. How about those who provide hospitalization at home? Home hospitals? Yes. And anyone in training institutes, universities? Right. Oh, yes. I know you, Abdel. Right. Anyone working in associations and trusts? All right. Where else could they come from? From other teaching teaching hospitals, centers, yes. Who have I forgotten? Yes, of course, clinics, private clinics and private doctors. Are you there? Yes, we are. You're very much there. Well, what I love about these congresses is that we learn a lot from them. I have my head full of ideas, and when I go home, it's, just so much bubbling inside me. It's wonderful because we get to know people, new people. We network. I had a selfie with Valériane, and I felt so good. We all have our idols, huh? So now, let's get to know each other better. Let's play this game then. And this is the mystery card, right? Do you know this one? The trump card, do you know it? Oh, it's not the word to be used, huh? Elisabeth, Cécile, just pull a card out and just answer the questions. Thank you. What's written on it? So am I supposed to look at it? Yes. What was the last event that made you so happy? Wow. No. I'm delighted to be here, I could say that. But it's not very original, is it? Well, yesterday I heard the birds. I listened to bird song. I was wondering which birds I was listening to, who was singing at me. So I used an app, which I recommend, and I realized that all those sounds I heard, they were sparrows. And then there are different kinds. And then there was another bird. It's called an accenteur mouchet. So instead of having, they have big beaks, big long beaks, and but actually they look like sparrows. What color are they?
Ils sont gris et bruns.
They're grey and brown, well, just like the sparrows you see all over.
Le ventre est gris, ils sont un peu plus fins.
Their belly is grey, but how are they, big or small? No, they're small birds. They're small birds. Batarangs. Well, how do they move around? Do they hop? Do they? They fly, but they can also hop around, you know, on the ground. Can you imagine this bird? So, well, you see, the thing is that when you tell a story, you think you can all see that bird too.
Le meilleur conseil que j'ai reçu.
Well, the best advice I ever got. That was the first one is very personal, and it was just be yourself. Now, those of you who don't know me, I'm very genuine, I'm very involved, very committed, creative, motivated. But since this is a professional congress, let me say something I've heard a lot. No matter what you do at work, always draw up a trace of everything that you do. Always jot down, make a record of everything you've done. That's extremely important. That's an interesting point. And anyway, thank you. A big hand to you. These values that you talk about, sincerity, being frank and forthright, and disciplined. And I think we all identify with these values, don't we? We have plenty in common. So, let's play. Now here, there's so many of us, nearly 500. Let's try that tool which is called the brand of silence. Do you know it? Okay, let me tell you all about it. Let me tell you. So, when you have a lot of people sitting there in front of you and you've got to have people talking to each other, if I need a silence, I'll raise my hand and you all raise your hand. So when you raise your hand, it means you want silence, okay? I have a card as well. I've got the last one. And on my card, it says, my next challenge. What's my next challenge? And my next challenge would be to convince you. To jot down all that you've recorded during the day. Ah, isn't that a good handing over? Now, up to you to play as well. Now, all of you, on your seats, you've got a card. Look at it and check it out with your neighbors. Go ahead.
Bravo.
Well done. Well done. How do you feel now?
Très bien. On a entendu des
Very
personnes
good.
rire.
I heard you laugh. And I also found you chatting with each other. I hope you got to know each other better, your immediate neighbors. And now that you've chatted with each other and you know each other better, and I know that you're very playful when it comes to pediatrics. I need volunteers who can come up here. Come on.
Parfait. Bravo, on a la première. Comment tu t'appelles? Héloïse, bienvenue.
Eloise.
Bravo, Héloïse. Qui revient?
Thank you, Eloise. Who's going to join Eloise?
Il en reste 6.
I still need another 6.
Bravo, on peut les applaudir.
Yes, it's true. Give them a big hand. Go on.
Alors, tu t'appelles Juliane. Bonjour
Juliane. Hi, Juliane. Thanks for coming.
Marie, merci Marie.
Marie, thanks again, Marie.
Thibaut, merci Thibaut.
Thibaut.
Presque l'équipe au complet.
We've got virtually the whole team now. Pauline and Isabelle. That's brilliant. How many are you?
Et encore la dernière personne qui descend.
One last person.
Et voilà, merci beaucoup. On peut l'applaudir bien fort.
And Charlene, the very last one to join our team. Thank you, all 7 of you. And well done, because there are 500 people here and 12,000 in replay. So we are proposing a game for you. Perhaps you've done it before. And it's called Radio France Corridor. So I'm going to give you, I'll tell you what happened during the day, I'll share with you what happened, and then you share them with each other, okay? Just one twist. It's just that we'll ask you to leave and then you come back one by one, right? Okay? All right, let's go. One stays with me, the rest of you step down. And you mustn't hear us, of course.
Merci.
Thank you.
On savait que Bénédicte allait pouvoir être la voix de la raison, c'est formidable. Alors, c'est quoi ton métier?
So what do you do?
Je suis puricultrice.
I work with children, okay? So you're quite used to it, handing over of instructions in the day, yes. So let me give you this text, which is totally improvised.
Ils nous entendent pas à côté.
They can't hear us, can they?
Les Bretons sont les meilleurs.
Britons are the best. Britons are the best.
Alors, je te fais des transmissions. Les parents de Camille ont sonné à 11.
Now, the parents of Camille, they rang at 11 o'clock. They were worried because they was complained of headaches and of tingling.
Ils avaient évalué sa douleur.
So the pain was considered as 8 out of 10 on a scale of 10. So I recommended 700 grams of paracetamol. And by 12, the pain was down to 6 on 12, but 6 on 10, but he refused to get up. These are neuropathic pains, so the doctor will have to be consulted for a better management. Brilliant, brilliant, says the nursery nurse.
Est-ce que vous pouvez chercher du coup une personne?
Okay, so you need one person.
Donc Juliane, ton premier. Juliane. Alors Juliane va pouvoir te faire
Juliane.
Est-ce que tu peux te mettre face au public? Tu sais, sur scène, on aime bien.
Can you face the audience, right? Okay.
Thibaut,
so Thibaut, come here, please. And talk to her, give the instructions. I've forgotten everything already.
Je viens. D'habitude, on n'est pas seul.
Well, normally you're not alone. Normally you do have an assistant nursery nurse. You have students.
Le petit patient sonné, enfin ses parents sonné.
Parents called around 11 o'clock because their child was complaining about burns and tingling in the hand, and so paracetamol was given to the child. And then around noon,
Lors de la réévaluation,
when it was time for reassessment, the pain was on a scale of 6 on 10, but we were wondering if it's neuropathic pain and perhaps consult the doctor.
Donc, personne suivante. Tu peux t'asseoir si tu as envie. Hein.
Alors, j'espère que tu as une bonne mémoire, ça va être un peu compliqué.
Now, I have a problem with memory. We have a child
Qui a sonné à 11 heures.
who came in and rang at 11 o'clock. He doesn't have a name. And apparently, he has a stumper. There's a part of one of his limbs missing. And that's where the problem happened, because they rang at 11 o'clock.
Disant qu'il avait mal.
And apparently, it hurt.
Au moignon, a priori.
The stump hurt.
La douleur étant insupportable.
Now, since the pain was unbearable, our dear colleague who forgot the child's name, the child with the stump, decided to apply a paracetamol, recommended that. And though she doesn't remember, she's a good nurse, she checked out an hour later to see the child. Maybe he doesn't have an arm. To check if the pain was still there, and as it happens, the pain was down from, let's say, down to a level of 6, but this nurse was wondering if it wasn't a neuroleptic pain.
Voilà.
That's the story.
Bravo!
Well done, well done.
Oh, ça va, c'est fini. Voilà, fais de ton mieux.
Do your best.
Bravo!
Well done.
Alors rapproche-toi.
Come up here, please.
Cette transmission.
It's time for the transmission, handing over of instruction.
Il y a un patient qui s'appelle
There's a child, a patient without, I don't know his name.
à 11h.
They rang at 11 o'clock. He rang at 11 o'clock, and he has a stump.
Il a probablement mal à son moignon
And it's probably the stump that's painful.
et tu lui as donné un paracétamol.
So paracetamol was given to the child.
Après, déposer la question 1 heure après de savoir s'il avait
So
mal.
an hour later, they were checking to see he was still painful, and it was
J'hésitais entre 6 et 8. J'allais dire
it was
ça, du coup,
between 6 and 8, I think,
et
6
du
perhaps.
coup, tu t'es dit, c'est peut-être une douleur neuroleptique.
And you were wondering if it was neuroleptic pain.
Bravo!
Voilà.
Well,
Ça va?
Ah oui, pas du tout l'impression.
Alors tu peux te rapprocher de ta collègue qui du coup...
so
va te
come
faire
up to your
une transmission.
colleague, and she's going to share the
On a pris en
news.
charge un patient.
So we've got a patient now
On a vu.
whose surname, a name we don't remember, and apparently the consulted at 11 o'clock, and he has a stump, and it's a stump that's painful. So a paracetamol was given to the patient, and then he was remonitored an hour later, and apparently the pain is neurological.
Neurologique.
Yes,
Je me
neurological,
souviens en tout cas.
if I remember correctly.
Voilà. Je réfléchis.
And let me think.
Non, je crois que c'est tout ce que je me souviens.
And that's all I
Eh bien,
remember.
bravo!
Well done, well done.
Alors tu te mets à côté de ta collègue qui va
Well,
te faire la
come
transmission.
to your colleague and she'll
Du coup,
tell you
on
what's
prend en charge un
happening.
patient.
There's a
on sait pas comment
patient
il
who's come
s'appelle,
in. We don't know what
qui
his
vient
name
pour
is.
une douleur au niveau d'un moignon.
So,
donné,
with a
un
painful
paracétamol à
stump,
11
so a paracetamol
On a
was
réévalué la
administered at
douleur
11
et
o'clock.
il a
He
une
was
douleur
rechecked
neuro-
later, and he has
pourquoi
a
neurologique.
neurological pain.
Salut.
Alors tu
Hi.
ta collègue qui va te faire du coup des transmissions.
Right, so listen to what the transmission's about. Hi, yeah, hi.
Prends en charge un patient.
So we've got a patient who's come in. We don't know this patient's name. He's 11 years old. No, it wasn't that? I don't remember anymore.
Il a mal, il a
He's in pain.
douleur à son moignon.
It's his stump that's painful. It's a neuro something pain. Neuro.
Neuro, on sait pas quoi.
Neuro
Et on
something.
on lui a donné du paracétamol.
He was given our paracetamol. Thank you.
Alors tu peux rester debout à côté de moi si tu
No,
veux.
you can keep standing if you don't mind. So you were the last one to receive the transmission. So now you can share that
Tes collègues qui sont ici.
with some of your colleagues present here.
Bonjour.
Good afternoon.
Donc, on prend en charge un patient.
So
dont on
we've
connaît pas
received
le
a
nom,
patient. We don't know
qui
the
a
patient's
11 ans.
name. He's 11 years old.
qui a des douleurs de type neuro quelque chose.
And he's got
À
a
son
neuro
moignon.
something
On sait pas où il
pain
est.
in his stump.
Et
We don't know
on
where
lui a
this
donné du
it is.
paracétamol.
and he was given paracetamol.
Bravo.
Well done.
Choisir des micros. Ça vous fait comment?
How do you feel, all of you?
Ce jeu-là.
This game, for instance, how do you feel about it? It's funny, isn't
Est-ce
it?
que vous
Yeah.
voulez avoir les transmissions originales?
Do you want to hear what the original transmission was? Okay, here we go.
Et est-ce que vous déjà, vous avez l'impression qu'il y a des choses qui ont été perdues?
Do you feel that there was information lost along the line? Laughter.
Ou un brin déformé,
Or maybe distorted to a certain
un
extent.
petit peu modifié.
Or changed a little bit.
Alors donc,
Mhm.
le petit garçon qui s'appelait Camille.
And the little boy whose name was Camille,
Les parents de Camille ont sonné à 11h.
Camille's parents came in at 11 o'clock. We don't know how old he is,
Ils se
deliberately.
sont inquiétés parce qu'ils se plaignaient
They
de
were
maux de
worried
tête.
because he was complaining of a headache.
Il disait avoir une sensation de
And
brûlure,
he
il était
said
complètement au niveau
that
de son
he
ventre.
felt that his stump was burning and tingling. And on a scale of 10, he said his pain was at 8, and he was given 700 grams of paracetamol. And so at 12 o'clock, his pain had come down to 6, and it was analyzed as being a neuropathic pain. And the consultation was to take place with his doctor for further examination.
Alors quand vous faites ce jeu-là,
So when you
qu'est-ce
play a
que
game
vous
like
pensez
this,
de la traçabilité des transmissions?
what do you feel about the tracking system that we have in transmissions?
Ça évoque la perte d'informations.
A lot of you lose a lot along the line. So what purpose does it serve to have a
Ne
trace?
pas oublier.
Well, to not forget and maintain a record. Okay, what else?
Ça permet d'avoir un suivi des traitements,
You get a better follow-up of treatment, which is required,
prise en charge optimale.
and then it gives a better patient management.
Est-ce qu'il y
Yeah.
a d'autres éléments que vous voyez spontanément là?
Anything
La
else?
fiabilité aussi des informations.
La fiabilité des informations.
Reliability of data, of this information.
Qui sont transformées alors que
And because we realize that you change things when you hand over orally, whereas in writing it's all factual.
Puis aussi, ça permet de retenir la précision des informations. parce
Plus,
que
you keep the
parfois, un
accuracy and the
collègue qui va
precision,
lire
because
les
sometimes
transmissions va
a
avoir
colleague
un regard,
reading
il va retenir certains
what
éléments
was
particuliers,
written
alors qu'un autre
would
collègue qui va
only
lire les mêmes
remember
transmissions
something else
va avoir
and
d'autres
interpret
éléments
it
que le
in one
collègue n'a
way,
pas forcément vus.
which the other
Et
colleague
si
would
ça
not
reste
have
juste par la
seen,
répétition orale,
etc.
ce sera perdu,
So if
ça.
it was just oral repetition or verbal handing over, you'd
bravo.
lose it. Yeah. Well done. Well done.
Alors, est-ce qu'on peut mettre le diapo sur le grand écran?
Well, can we just see that on the big screen now?
Donc, en effet, quand on se demande pourquoi noter les transmissions,
So when you ask why you need to note down your transmissions, for everything you mentioned, it's about speaking the same language. It can be consulted by everybody at any moment in time. And
un gain de temps.
it's also a time saver for you for us as professionals. And when you talk about medical legal considerations, it brings value to the work done. Here is what we've done. And so it provides for better convergence. So we like this sentence. I do, I track, and I reassess.
Au CHU de Rennes, on a mis en place
And in Rennes, we have what we call some Clued minutes. These are short videos, and each video addresses a specific topic. We've got several that we've published on tablets, on taking codeine in a secure manner, and one, why should we track and trace pain even when it's zero? We thought that this might be an interesting one to show you, so I'll be showing it with you now. Reassess, track and trace, Clued minutes.
Pourquoi est-ce qu'on trace la douleur?
Why do we track and trace pain even when it's equal to zero? To ensure continuity of treatments. So it's not just to tick off boxes, it's to ensure continuity in terms of the treatment. It's also important to know if the patient had pain or if they didn't.
Parce que c'est notre job
It's our job to ensure a full follow-up as well as a professional follow-up. if you don't note anything, it's as if you haven't done anything. It's proving that it also proves that the treatments work. We're not magicians, but if you have a 5 and go to 0, that needs to be noted down. It's something that we check with the patient, and so it's number one. It's part of the quality indicators that we use in the framework of our HAS certification. And secondly, when you ask a question to a patient, you need to note it down in their medical record, whether the level of pain is at 0 or 10. Whatever hasn't been written is not considered by judge. We have to note absolutely everything, even if it's 0. And even if it is 0, it means that the job is well done and it shows professionalism. When I'm not sore and it's noted in my patient record, I feel reassured as to my follow-up. And even when I'm okay, I'm sure that they're taking good care of me. It's like temperature. It's like your blood pressure. It's constant, like any other. When it's normal, you note it down. And when it isn't, you have to note that down too.
Voilà.
So there you go.
Alors, je voudrais vraiment qu'on remercie nos volontaires qui ont eu le courage de venir sur scène et qui ont joué à ce jeu. Donc, vraiment, bravo à vous toutes et à vous tous.
And they really played the game. So thank you. Time. So with
Un immense plaisir
it's our pleasure now
accueillir à nouveau Bénédicte
call
Lombard,
upon
infirmière
Benedict Lombard, who is a nurse senior health executive. We introduced it this morning, so you've understood that she's a philosopher. And Thierry Moreau, who is an anesthetist nurse and works in private practice, and will be telling us about touching, suggesting, distracting, instruments to be orchestrated. So the floor is yours. Hi, everybody. And we will be presenting all the tools we have to soothe and accompany patients when we treat them during their illnesses. We know that pain is a subjective phenomenon, right? And it's multidimensional. But it's not just limited just to a physical feeling. It has several dimensions, whether it be sensory, emotional, especially amongst children with their fear. They're scared. And the positive associations and past experiences and behavioral. And it has a social impact too. And the whole context and the cultural context and the entourage. And so we have several solutions and means to better take care of pain, whether it be via drugs or via other solutions. And in any event, it's a legal obligation and a moral obligation for healthcare patients to manage pain, whether it be linked to the treatment or the disease. This article of the 2nd of March 2002 stipulates as much. And there are international recommendations too that are in favor of the combination between drug-based solutions and non-drug-based solutions, such as touch, massage, distraction. And in national plans that we have here in France, the second was by Kushner in 2005, spoke about handling pain in children. And then there's the third 2006-2010 plan by Xavier Bertrand, sets it as a priority. The priority being to make use of both drug-based solutions and non-drug solutions. And that was set as a priority during the 2006-2010 plan. And so the more you manage to grab the attention of the child, whether it be cognitive, emotional, or through sensorial, then it leaves less space for feeling the pain or the perception of pain. And so we have a test. Maybe some of you know this already. And it's about selective attention. And the question is, are they able to be attentive to everything? And the answer is either yes or no. And the instructions is to count the number of balls kicked between the players in the white team. So I'll leave it to you to detect it. How many passes does the team in white make? And then I will hear back from you at the end.
answer is 13.
And so some of you got it right. I mean, you were really focused. And so what do you see? What's appeared here? And there's somebody right in the middle who wasn't there before, who's having fun. And if you just focus on counting the passes, you don't see the other person come in. And so this is proof of the fact what we said before is when you have when your attention is taken up by something else, you don't see anything else. So there was a bear apparently. Did anybody see the bear? Only half of the people. Maybe they were less focused. There was some animal that came in the middle. And it's just a very good example of the fact that your perception is guided by your attention. And what you don't expect can become invisible, actually. And when your attention is focused on the task at hand, and we asked you to count the number of passes, then it could prevent you from picking up on other pieces of information which might be obvious and very much present. And distraction is a part of the tools that we use in pediatrics, and we'll see more about that just afterwards. And drug-based analgesics and distraction share the same objective. It's all to combat the pain, and by saturating perception, making the person be attentive to something else where reduces the impact. And in the pharmacological family, of course, or non-pharmacological, we speak about touch and feel and distractions, and VR, virtual reality. That's also coming in more and more. And there's certain games, so there can be visual games. Kids are very much attracted to this from a sensory perspective, and the multi-sensory experience. And so it's a game that stimulates several senses: hearing, touch, smell, sight, and it's extremely interesting. And so we focus on distraction, touch, and hypnosis in our presentation. And I'd like to just start by showing you a film to show you how touch works on the skin.
Le toucher, comment ça fonctionne?
Touch, how does it work?
Le toucher ou tact ou encore
so we say tact or taction as well. Through touch, it provides us with information through contact with the skin and an object. It enables us to pick up on pleasant feelings or unpleasant feelings. It tells us about what surrounds us, and this can be very crucial information. Touch is the first sense that any fetus develops. It's essential for babies to learn, and it also serves as an alarm system or an alert if you burn yourself, for example. We have numerous sensors that are throughout our skin or the epidermis with a variable density depending on the area of the body. All of it together forms a true system which contains several types of receivers, and each of them have their own role to play. So there's the Merkel cells that react to light touch. There's the corpuscle, the Messner's corpuscle, which feels friction, and Ruffini to stretching, and Pacini to strong pressure or heavy pressure, and Krauss is sensitive to the cold. And then there are the nociceptors that perceive pain. And these are the ones that get us to pull our hand away when we're in contact with something that's too hot. And all this information is thus collected by the receivers, and then are then sent to our brain through the nervous fibers and through our marrow or our spinal cord. And so it's the brain then that will interpret and decipher the information. And so we saw the activation of the skin and sensory senses, but that's not the only thing that we have. all other type of effects, there's also hormone secretion. We have 4 hormones, so oxytocin, serotonin, endorphins, and dopamine, and that's what's very interesting. We know that oxytocin is the hormone of confidence and ties, and endorphins, of course, are natural painkillers, and dopamine is motivation and pleasure. And what's interesting in all of this, when you have a massage, is reduces your cardiac rhythm and your blood pressure, and it encourages muscular relaxation. And so you've got different types of touch. There's the reassuring touch. It's just, for example, holding someone's hand. It enables a child to feel reassured, the fact that you're standing alongside him. And if you hold the child's hand, you can also gauge what condition they're in. And it's not just a gesture. It's non-verbal communication, which is quite powerful in itself. It engages the body, the mind, and creates a tie. And then there's therapeutic touch with massages, for example, and it acts on all sensorial components. It's attentive. It's supposed to accompany. It could be exerted by pressure or massaging a hand, and it modulates the pain. And so there are other means. There's counter-stimulation. You might have heard about Bazi. Bazi combines vibration and heat and cold, hot and cold, and it enables you to get the child to focus on 2 different types of sensations. It's a distraction tool that we use a lot in the field of pediatrics. It's part of, we could also use active distraction like cards. It's distracting the child from the pain through touch, with a play on hot and cold. This has been proven with vaccinations. These 2 different sensations with the cold, we do the injection, and then that can also be helped along with the vibration. And there's also multisensorial gel that I will speak about a bit later. And then there is the treatment touch. So if you undergo medical examination or treatment, touch and feel is very important. And even if the contact is a technical one, it still has to respect the principles of having a progressive approach and consent. We spoke about this morning. You need to also be able to communicate, and that helps you to approach the children and furthers the interaction. It's not because you have a treatment to carry out that you can't be respectful. There's also pediatric ethics that need to be complied with. And so it's very important to get preliminary authorization from the child. It can be explicit through the behavior, not just verbal. And the approach needs to be a progressive one. And so there's a combination of communication as well as touch. You need to be able to ask the child, can I touch your arm? Can I have a look at your arm so I can apply the dressing? And this authorization will build a relationship of trust and reduce anxiety and the potential trauma experienced by the child. And as we explained, we have a lot of pharmacological means that are available to us. And my colleague will tell you more about the way we use distraction just afterwards. So thank you very much, Thierry. As you will have understood, there are 2 of us in this presentation. What Thierry didn't say, because he's very modest, but he is a pain reference nurse, but he's also a trainer when it comes to massage and touch and feel. He has done this for a very long time, and he trains people in hypnosis. So he, just on his own, he already embodies the very subject of today's conference in terms of how can we combine various tools available to us. So here we found a living example of somebody who really does all these practices. Touch and feel, massage, hypnosis. Thierry does all of that. And so it was very important for us to be able to present this aspect together. So we said we're going to speak about distraction, touching, and hypnosis. So as part of the distraction family, there are various cards that you have to play. And so in the non-pharmacological methods, we've got fairy tales, nursery rhymes. We've got bubbles. Those are the favorites. It's inexpensive and it works works very well. Then there are visual games, there are art books as well, and there's so many other cons that we could have included. But what we want to talk to you about today, something that you might say, well, no, that's just, why are you telling about this? This already exists. But nobody has ever actually said as much. And we want to talk about an approach which is complementary to the reassuring and therapeutic touch and feel that Thierry told you about. And we would like to raise awareness of the benefits from combining touch and distraction to combat the perception of pain. So in the family of touch and feel, what we're busy doing at the moment is we're adding new features which we used before but never had names. And now it's been written down in the literature. And there was a paper by Natalia that actually spoke of something quite funny. And Natalia drew an analogy. She used a metaphor. And she spoke about the way you touch a child. And she drew an analogy with white noise. So for white noise, it's about not necessarily hearing the noise that's alongside. And in her article, she speaks about the advantage of associating touch with something else so as to distract the child from a sensory perspective. And that's why we talk about touch distraction. So touch distraction, it's an anticipation for the treatment touch. And so we show some videos that will give you some examples of how this is used on children. Distraction is something that we use with patients under the year of 3 years of age. And this is how we prepare when we have to do an intervention or we need to insert a catheter. And it's a synergetic type of action. And it's supposed to draw attention away from any pain peaks because it saturates the sensory system of the child, drawing their attention away from the pain peak. So here we have an example.
Il sort sa tête. Et après, regarde, il tourne. On refait. Oh, c'est froid, c'est l'escargot. La baffe de l'escargot. On recommence avec un autre exemple.
So another example, and this is inspired by magical massages.
Je vais fermer un volet. Je ferme le deuxième volet. Je fais un bisou à maman. Je fais un bisou à papa. Oh, je m'essuie les pieds sur le paillasson. Oh, je ferme la maison à clé. Et je passe le tuyau d'arrosage.
And so here we have another video example where we have the summum of what you can gain from distraction pain. So it helps to anticipate on the treatment itself. It reinforces the distraction effect, and it competes with the peak in the pain felt by the child.
Good. Yeah. All right. Is it a 1, a 2, a ray? Good. Yeah. Okay. Bend it. It's a bend it.
Vous voyez,
So in Pédiadol, you don't necessarily need Myopa to make people laugh, right? And so carrying on, in line with what we've just told you, you might remember that we spoke about touch as a distraction, how to draw attention away. And now let's take this a step further and look at hypnosis. So what is hypnosis exactly? Just a reminder, a lot of people know what it is, but it's a state of modified consciousness characterized by focused attention and peripheral consciousness that's been reduced with high receptivity to suggestion. So I put this definition because I wanted to lead you towards the topic of suggestive hypnotics, and it's about making proposals, verbal proposals with images.
I'd like to remind you that we are talking about three main components of hypnosis. The first one being absorption, and that is the focus of attention. Second one is dissociation, and the third one is suggestibility. And so here again we get back to the idea of suggestions. Let me remind you that hypnosis is a process, and so there'll be different moments of a nothingness that's happening. So we will be looking at touch and suggestion. That will intervene several times in the process. I want to talk to you about this survey that was carried out by this research. It's very recent, 2023, and it shows that very simple semantic statements can change immediately and sustainably the tactile or the touch perception. This was proposed to the participants. Say, for instance, your index finger is bigger or smaller, or it's fatter or well. So when you say to people that your index, when you're hypnotized, is bigger, and you see that people seem to differentiate better against stimuli which is close. But if you tell them that your index finger is now smaller, there was a deterioration in tactile, in touch and feel. So these statements didn't really change the size of the finger, as you might imagine, but they influence the way in which the brain perceives and processes this information. Now, why are we interested in this in particular? Well, I would say that because if it works one way, it works the other way too. We who do carry out hypnosis and suggestion can imagine that this principle can be reversed. And so we can make suggestions at the same time as we do our touching, and so we increase the force and the strength of these words, and that's what we call touch and suggest. Once again, when you look in literature, you find nothing, because no one's really talking about this. We are in a sort of hypnosis for analgesia, and we are touching people, we are touching children. You saw that. In treatment, that's a must. You really have to touch the children. And when you do in pediatrics, when you do hypnosis and analgesia, we do touch the children, but in a suitable way, but no one really talks about it. Nothing's described in the literature. Of course, there are a few practitioners of hypnoanalgesia who will talk about a double link, a dual link. So touching and suggestion, in fact, it amplifies the effect of hypnotic suggestion, and it actually applies this, what's happening. It becomes a reality. So now, how do you treat a child with Myopa? So let's say I say to the child that there's all this glitter that's come and settled on your arm, and then you ratify this feeling because you know that Myopa, you might have that feeling as well of tingling or something settling, a deposit on your arms. So you can have a sort of suggestive touch on his arm. Just lightly brush the child's arm to give that impression. And that'll help child to focus on that feeling. So there are several methods and several ideas behind this touch and suggest. Here's a video, and okay. How do you feel when I hold your hand? Do you like it? Yes. So now this is a signal. You give me a signal. Okay, you just reach out to me as you like. Oh, you're doing this really well. And it's amazing because I put my hand here on the nape of your neck, and I find that you're at the same time as you're breathing, your nape is breathing as well. So now you can just concentrate, focus just on that. Just think about your breathing and this feel of my hand against your nape. It might be at the hand, in your hands, or at the nape of your neck. Your breathing is talking to your hand or to your neck. I don't think I have much time. Yeah. This was an example of a hypnotic script. We could have continued the game because yesterday there were people in my workshop. Yes, thank you. No, this is a private joke. So you'll see these examples, of course, if you want to. With Thierry, what we want to do is give you very practical examples of what you can do, of gestures that you can repeat quite easily and use them really very simply. So, to sum up, we talked to you about things that you all know, that is that touch massage, and we also insist on this marvelous magic massage workshop that Roche-Posay has, and they have brilliant trainings with them. They have great videos too. Now, there's the one about the little house where you go around the house, your little house, and then the little snails. What's new here is to think about things like this. You've got this care providing with touch, and the idea is to bring it in with touch and distract and touch and hypnotize. I know it was always there, but what's original about what we are offering is that we are planning now to bring these all together to have a sort of convergence. Touch and sensorial confusion, and then extend it to use all these strategies even further, reach out, go further, and bring in other gestures. And what's more, we could write it down. So far we've been just doing it instinctively and intuitively, but let's write it all down, put it down in black and white, because that'll improve all our practices. Because when you see it in writing, you say, oh, I did that before, I've done that already. However, you need to step up and do it deliberately the next time and not just instinctively. And so that would help you to adapt to people's pains better. Thank you. Well, good afternoon. So with Ellen, we'll speak to you about a project that we set up with home hospitalization in pediatric units, and that is for music at home. Let me just tell you what pediatric home care is about. So this is for children from birth up to the age of 18 at request of the hospital doctors. So that avoids hospitalization and unnecessarily running up and down between hospital and home. So this would be newborn babies, children with gastric problems, with dialysis, hematological problems, or multi-handicapped children. Because giving pain relief is extremely important for us. And just to make sure that there is no further complications. So our main concern is, of course, providing relief for the child in our team. Pain relief. So here's a case. This was in oncohematology, so care was required regularly for this child. And this was a puncture on OPAC, and the child was just terrorized of all the care that was supposed to be delivered. We had tried different methods to distract him. It worked really well, but I realized that we weren't really trained about the use of music. So we went to the Carte Blanche project in 2021, and we created a working group on this subject. And we found that anxiety at home is extremely high for children and parents because most of the time you're all alone to deliver this care. we try to propose different kinds of distraction through games, sound, melodies, because our voices are also a great way of distracting children, and we don't use it enough. That enabled us to democratize the use of music during care. What's more, we had the parents involved providing care differently in the treatment. And what's more, we found that there was a reduction in anxiety and stress in children, especially for those children who were using monitors and screens too often. So the solution that we found for our problem was to receive training from in musical therapy from an expert in this field, and to become independent. So she suggested a toolkit with just the right instruments according to the child's age. Now, we're not musicians, quite honestly. There might be one or two who just play for their personal amusement. So we picked one or two instruments for our visit, and for children between 0 and 1 year of age, we use the koshik, what we call the koshik. And that is to improve relationship between mother and child, and also to do blood checks. And for children between 2 and 9, we use this little back scratcher. It's like a rattle. It makes a noise, and children like it. You've got the xylophone also, and you've also got those finger puppets. And that's for dressings, for the mainline introduction or catheter, and that enables parents also to be involved. For children over 10 years of age, and that's for teenagers, of course, it's complicated. We've got Gembe and Kalimba that they like. It's these instruments. And so we have a special link also with the carers. Here are the pictures. As you see, there's a child, a brand newly born baby with the mother, and who's looking quite appeased and relaxed. And in the second one, it's a teenager, and who's playing with the kalimba. And with the sound, I can do the lumbar puncture, and I can distract him while I'm do the dressing and that. Plus, that trust is increased. Let me show you a video now, and in the video you'll have 4 different cases of music and care in pediatrics. Nina and her mom. And that's a roar. Barbara and her mother. I think it's broken. Oh, I can't see, says the nurse.
Donc là, il y a 4 situations différentes.
So these are 4 different cases. In the first one, you had a child in neonatology. So it was difficult for the mother because the child had a very special faciès, and thanks to music, that the child was so busy playing with the musical instruments that the mother could actually clean up her nails, the child's nails. In the second and third situation, or fourth one, it was children in oncohematology, so this requires regular care. And so there was the dressing for the mainline, or the mainline bundle that had to be dressed, difficult for the mother and for the child. And so we have the mother playing the colombo as well as the child. And then in the last one, you had the child playing with finger puppets while the mother played on the xylophone. The middle video was about a multi-handicapped child, a broken arm on the right. So on her finger, she was playing with finger puppets. And she was also involved in what was happening around her. So we had this questionnaire to ask them if they liked our method with the parents, the care providers, and children. So for the children, we use smileys because we have a huge variety of diversity of ages. On the whole, the benefit was positive. They were willing to accept the care even before getting it, and there was a reduction in the feeling of pain. And feedback from parents, 80% felt that they were playing a more active role in this pain management. So this was much better than what they'd done before in terms of therapeutic care. This enabled them to really make a contribution, more positive contribution. So they were really playing an active role with their child and his or her treatment. And some parents who were musicians and who had forgotten about this aspect of their skills brought out their old instruments during the child's care period, so which brought a greater bonding between everyone. As far as the care providers were concerned, that was also a positive impact, especially for care at home. During the application of the care, there's more happiness and more involvement and more acceptance of everyone. Plus, the child feels less pain. We also had this experience where, for the dressing of the mainline catheter was given Meopa. We were not obliged to use so much Meopa, but just the sound of the voice and music. And for us nursery nurses, we had a different relationship with parents and children. Testing these instruments at home helped us and the parents to just make cultural discoveries. As we said, it involves the parents, it reduces anxiety and care, and it's very helpful for us in our daily routine. It's a plus point for all of us involved in this care routine. So the music brings in the family, and the music brings everyone together. That's what I would say. So Mathieu is going to speak to us not so much as about methodology, even if it is important, but he's going to speak to you about how to organize and how to coordinate and how to concentrate on child's well-being between professional HPCs and as it says, make sure that proper care is provided in the right conditions. So he's a doctor and very involved in readaptation in Strasbourg area.
So hi everybody, and thank you very much for these words of introduction. I am indeed a pediatrician. I practice in Alsace, and I'm going to be showing you a slideshow that comes from the thesis that I worked on last year. And because I was qualified, specializing in combating child pain, and I attended Pédiadol last year, and I'm back again. So when I talk about botulinum toxin, who's already participated or done or had any dealings with this? Quite a few. And so for the 60% of you who didn't raise your hand, just a couple of reminders on the toxin. The aim of the toxin, it comes in, injections into the muscles, and for children 2 years onwards. And so for people that have neurological lesions, they have stiff limbs, and the toxin combats that and acts against that. And so today, this is something we use extensively because there's not a huge number of alternatives, and there are certain surgical solutions and pharmacological solutions that have appeared, but we don't have as many options as one might think. The use of this toxin is that it's something that acts in general between 3 and 6 months, and we tend to repeat the process throughout the growth process of the child, and so the child knows that they have regular appointments, and they start building anxiety because they remember how it went the time before. So that's why it's important that things went well the time before. And the objective sorts are mainly functional. So these are children that have one or several neurological pathologies, but it's not a vital gesture for some of them. For some of them, it's just to combat pains. It can be for a young child whose hand has been in a fist since their birth, and it's aimed to relieve that. And so this joins up with the whole philosophical discussion we had about consent. The discussions from this morning resonated with me quite a bit. So in practice, in terms of the difficulties, on the left, you have a diagram of a leg. And toxins for the children are mainly for the lower limbs. And so here is the muscle. We tend to inject one leg. Sometimes it's only one leg, and sometimes it can be two. And you can see that there are several injections that are involved in the treatment. It's not always a very pleasant experience. And with kids, having a needle linked to a machine, it makes a noise. It's linked to a machine that crackles, and sometimes you can see some electricity. It's quite destabilizing for them. So more and more, we try and make use of scans so that we don't have to stimulate the muscle. We can make less noise, but not every team does that. And also, another difficulty is the target audience. These are children with neurological lesions, and this doesn't mean that they are intellectually deficient or they suffer from autism, but for the most part, these are children that are overwhelmed with their emotions. It's very difficult for them to depart from their apprehensions, and when they start to panic, they become a lot less accessible in terms of our capacity to reassure them. So this is a treatment that is indispensable. And that's why Sparrow Dryer, they didn't make any mistakes, because they've got their own brochure that focuses on this treatment, even if it's not a treatment that's familiar for everybody. So what did I do for my thesis? When I arrived in Alsace, it was quite a specific moment in time. Alsace is not Brittany, it's on the other side of France, but it's also a very pleasant region to visit and to live in. I studied in Strasbourg, that's the red point in the middle, and the blue dots were where we had administered toxins historically over the last few years. But when I began, all the places with the blue dots had stopped, and we had a lot more patients that were now arriving in Strasbourg. So you can see it was like a 2-hour drive, especially for those in the south. And so they already arrived pent up. And it was considered to be a very old type of treatment, and pain wasn't one of the primary focuses. And so my objective was that things go as smoothly as possible with as little trauma or less trauma. And in terms of the methods that I used, I didn't have a lot of resources, but there were a number of good ideas that existed for other types of treatments, and so we drew on best practices. And what did we base ourselves on? It's more or less the same things that we've been hearing since this morning. There are 3 aspects to it. There's the non-drug related solutions, distraction, VACOG, the presence of parents, cryoanalgesia, having a better environment, and there are the drugs. It's the race to find the right drug, MIOPA, And for me, MIOPA is a basic necessity, but it has to be combined. There's pre-medications. And you could also use sedation and anesthesia. And something we tend to overlook is assessment or evaluation. Like we said, it's all and well to say, yes, it was fine. It hurt him a little bit. And this is often the comment that we saw in the medical records before. But you need to take into account the child's opinion, the parent's opinion, and note if there was any restraint, if the person, how the child was restrained, if they were restrained, and all of these service markers that guide us in future operations. And so this was the focus of the work that I did. And the three aspects brought about another set of conditions, and which is the doctor, the patient, and the healthcare professionals. So you could think that it's for the parents to distract and it's for the doctor to treat, but that's not really the case. Everybody needs to do everything. MIOPA won't be as successful if it's applied to forcefully applies it to the mouth of a child that's not willing. So the parents have to be there. There has to have been a presentation by the nurse of the treatment before. Pre-medication, it's all in well to speak about it, but you need to take time. The doctors need time to prescribe them. For the parents, it will take time for them to give the medication to the child or apply the regimen. The healthcare professionals also need to explain the follow-up for the child. And then distraction for me, everybody has a role to play in distraction. And when you spoke about touch and feel, this is something we use a lot, but I've never really thought about it if there was any scientific proof to back its benefit. But whether you be a proactive player or just an assistant, this is something that's always useful. Having the presence of parents, and this is something that should be encouraged by the HCPs, whether it be the nurses, the assistant nurses, the doctors, and all of this acts in combination. And then, of course, evaluation and assessments. And for me, that's also multidimensional. You have to factor in every player's opinion. Toxins, very often, are a treatment that can be traumatic, not only for the children, but for the parents too. And obstacles encountered. Well, the first one are preconceived ideas when it comes to disability. Very often when somebody's suffering from severe disabilities, that comes with preconceived ideas or prejudice by the physicians, by the HCPs, and by the parents. And sometimes when you have a patient with severe disabilities, somebody says, well, do we really have to go through all of this because they're not really responding? It doesn't really seem to affect them. And so there's a number of ethical questions that arise from this, but I won't be able to cover those in the 10 minutes that remain for me. And also people tend to say, well, we're not going to do all of this because it's just an injection. Taking out the EMLA, taking out everything we need for the MIOPA, the compresses, the pre-medication, and having to take all of that out, and it's locked away in a cupboard, and I don't know where the key is. And sometimes the desire and the motivation isn't there, but it's part of the game and needs to be played. Lack of time. You're all healthcare professionals, or you all work with healthcare professionals. And unfortunately, this is something that we all share, the lack of time. And when it comes to pre-medication, it means having a consultation with the patient. It takes time. It takes time by the medical staff and the secretariat. The parents then have to pick up the drugs at the pharmacy. They have to look at the regimen and apply everything. And you have to apply it at the right moment. When you have pre-medication, it can't just be given 5 minutes before in the waiting room because it wouldn't have taken effect. So it all has to be done in the right timing. And you mustn't overload schedules either, just to make sure that you run on time and that you don't start with a 2-hour delay. That's not always easy. And then there's also comparison with other population groupings. I work in several hospitals, and so there's certain hospitals where they specialize in adults and children. And so somebody else says, well, you should see how this all plays out with the adults. It's different. And of course, maybe the schedules for the adults are a bit fuller, and maybe they don't have as much time to do all of this. But pediatrics is different and should be considered differently. It's a different type of exercise. And there is an obstacle that bothers me. This is the one that probably bothers me most. And this is something I worked on a lot, is that sometimes when you have kids with chronic diseases and they've had very complicated backgrounds with multiple surgeries, plaster casts, physiotherapy almost every day, people tend to make these children out to be heroes, and that could have a negative effect. That could be dangerous. We all know Nathan's little smile when he was courageous for his stitches and he gets his medal with his diploma. But we've got to be careful not to undermine the children or just say, oh, well, he's a fighter. He's used to fighting. So, doctor, don't worry. My boy is a strong one. And in illustration of this last point, if you type into Google and you put hero neurological disease, you've got the keywords, you're going to come across lots of different things. You've got the cerebral palsy warriors. It's an association. And a good example of this is that we have 300 to 400 injections administered every year, so we've got a lot of data to go on. And when we look at the children that have long histories of re-education, surgeries, and plaster casts, and orthopedic pains, and when they assess pain, and the child provides a mark which is a little bit beyond that of the parent and sometimes a little bit beyond that of the HCP, this tends to be the other way around. And so the children are still experiencing pain. And the HCPs tend to underestimate this pain, and the parents underestimate their pain even further, which is a pity. It's a reality that we've observed, and it is something that you need to be aware of. So I know I was a bit quick, but I am done. It's a great pleasure to be with you today. We'll be telling you about how to learn self-hypnosis. And we realized in our presentation we hadn't told you what hypnosis is, but Bénédicte Lombard did that for us just before, so thank you for that. And amongst you, we think there are a lot of people that must practice hypnosis and a lot of people that practice therapeutic education. And we're going to be presenting a project that we created thanks to the gastropediatric team at the University Hospital of Lyon, which links up the both in the field of therapeutic patient education. And so I'd like us to play a game whereby we're going to project. We did this earlier, and I'd like us all to project together. So just pretend you're not in an amphitheater. You are patients and you are participants in a group of 2 to 4, and you're being followed by the gastropediatric team. You have a chronic pathology, which is chronic colon inflammatory disease. It's very hurtful. You've got a long history with pain. And the session's supposed to last 2 hours, but we're going to be having so much fun in being together that you're going to get the impression that it was only 10 minutes. And in that time, your parents are attending a patient's association, and they're taking time for themselves. And so like all patients, when it comes to therapeutic patient education, there's going to be a shared educative assessment. And we've got a great coordinator that we work with who is going to give you the possibility of joining up with one of our workshops. And so the workshop itself began on the 15th of May. We had 4 patients that were initially planned, but 2 unfortunately were no-shows. And the same thing happened in June. We had a few more patients. We were supposed to have 6 and 4 turned up. And on the 16th of October, we had a dedicated day. It was a day dedicated to therapeutic patient education. People came especially for this purpose. And so we had a good turnout, apart from a couple of no-shows. And so in the shared educational assessment, at this point, you don't necessarily have experience with hypnosis, or you don't have the impression that you've undergone hypnosis yourself. And yet it's a session that will enable you to express the way you feel in terms of your experiences with hypnosis, and you start creating a safe place and a ritual for these sessions or these seances, and a tool which will enable you to become more firmly grounded in these sessions, as well as to try out your first sessions with hypnosis. So we ask the youth and we ask you, what do you think are the words that best represent hypnosis? So a lot of words came out. There was the feeling of appeasement. We heard about relaxation, medical hypnosis, being calm, tranquil, a little bit like you're in a bubble. And we ask them, what does hypnosis mean to you? It's always important to see what it means to the patients before you can begin. How is it represented for them? And so some children were saying that there were other types of hypnosis that they'd heard about, and that it's a form of entertainment, that it's a means to make you do what you might not want to do, and basically things that you might not agree to. And this type of hypnosis is that which you find in live entertainment. And so we need to break down these preconceived ideas in terms of what they've seen in the entertainment industry. So there's different types of hypnosis. And in medical hypnosis, people choose to go under hypnosis. And then we ask the question, so why do we need to be hypnotized? What is the objective? And we heard, well, maybe for my stress, when I'm having exams or when I have to come to the hospital for my anxiety, when I've had a fight with a friend, that might be something that could help me. And what was interesting was to say that there are very few children that said to combat pain. We needed to go and pull it out of them and say, well, when you come to the hospital, don't you think it could be useful? Don't you undergo treatments? Well, that's true. That's right. When I have blood taken, but it wasn't a spontaneous reaction that they had, and that was very interesting. Or when I have a sore stomach, is that true? Could hypnosis work on that? Can I do it at home? I don't necessarily need somebody to guide me, and that was something that was new for them. And so the idea was to say, well, maybe hypnosis can help me every day in terms of what my disease puts me through, but maybe not only. And so how and when do we practice hypnosis? This has happened to all of us, and this has happened to all of you. Maybe while in a classroom or an amphitheater. Maybe you start looking and you kind of lose touch. It's the end of the day. The voice of the person who's speaking is very calm, or during digestion. You kind of disconnect. You can go into a hypnotic state quite spontaneously, and it can happen several times during the day. And you can go into a hypnotic state even without even realizing it. What comes to mind is children at school. That's something we see often. And then you think to yourself, well, maybe there's something that can help me to enter a state of hypnosis. So there is focusing your attention. And saying, well, maybe if I focus my attention, if I'm looking with my eyes set on the TV, on my phone, maybe my mind wanders off somewhere else. And so we suggested 4 points of focus to help. And so we said either you can just look at a set point, listen to a piece of music, smell a fragrance, or just feel yourself breathing. Because being in a hypnotic state, we all have our preferred senses which help us to enter the hypnotic state. Some of our senses are more conducive than others. But the question is, where do you go and where are you when you're in this hypnotic state? You can be here, you can be anywhere, you can be elsewhere. You need to define a place you're going to land in that's going to be pleasant, something that belongs only to you, a place where you feel good, comfortable, and safe. And this is the point where we propose that our patients draw or write, do something with their hands, and also create something with their imagination. And if the children want to do this, we also ask them if they'd like to share their safe place with the rest of the group. And so, Makili, would you like to share your safe place with the rest of the group? Well, this is something we do in the group. We do it at the same time as the children because it creates a tie. And we're also giving of ourselves. It's usually we have it in a very comfortable apartment with parquet flooring and skylights and good ventilation, probably the sea and a sofa with a blanket and maybe a fireplace. And what we realize is that all the children accepted to share their drawings with us and to put words on it and verbally tell us. And so this helped them to become further entrenched in their safe place. And then we take them through a guided session. We have them do the exercise in a group first in terms of the safe place they envisaged, and then it becomes tangible for them. And then sometimes after the first session, we don't leave a lot of time between the two sessions, and so we'll have two successive sessions, and so the next one they'll go in deeper, and so we put them into the conditions. We ask them to choose their set point of focus, and then we ask them what happens when they do this exercise on their own.
So we ask them to have a kind of diary of resources to write down what they'll do in the future practice. So they jot down very personally what their aim is, what their goal is, why are they doing hypnosis, when, how, where, because, and we ask them what their focus is and what they're thinking of. So in this little diary or notebook, we talk about my sessions of diving when I go into hypnosis. It's like when you go diving, scuba diving, and you see all the underwater life. So we asked them what happened during this auto-hypnosis, how long did it last, and what it did for them. So the use of this agenda is in fact something that we were doubtful about. Would you be able to jot down all these little details? But we got immediate details, like I can see what I'm doing and why I'm doing it. It's because I'm extremely tense, and just to relax, I'm very stressed. And they also determine the right times to do it. I like to do it at home when I'm just by myself, or in the bus when I'm going to school. So this was very useful for them to jot it all down in their little notebook. And then some would talk just about breathing, and then when I'm there at the place where I actually do it, I think about colors, I think about feeling and touching, etc. So this discovery and this taking ownership of self-hypnosis was really great, particularly for those who have autoimmune diseases. And practicing it as group therapy is a very intimate gesture. But to be able to trust each other and share with each other creates a sort of bonding. That's what we see in these self-hypnosis groups in the ETP. They really want to do it. They want to practice self-hypnosis. And it's very easy for them to actually get into it. So it's just like in hypnosis and self-hypnosis, you have to give them the tools to do it. Because the very basis of it all was because patients come back and they'd say that they've got, for instance, these constant issues, not patients but the caregivers. So using self-hypnosis and ETP, you're taking care of yourself. It's really self-care, and you acquire a new skill while you're at it. In the future, we would like this session be followed up by other sessions, because we only see them once, these patients, and we systematically suggest that they come back, if they come for hospitalization, to talk about self-hypnosis again, that we could help them again. And that's what we'll do in the future. We'll propose it to other children suffering from other diseases. Well, thank you very much. So this team from gastropediatric issues has really helped us here. And then we also had hypnotic suggestions with it. Mr. Hypno spoke to us a lot about knowledge. And by playing this game, if I go around my house, you do provide yourself with this touch and care, and so you can inject children. You can actually give them a pinprick without children feeling it. Now it's time for discussions, because I think all the teams in their own way have all spoken about suggestion, touching. We have a question on what's applicable in adults in all that you've just offered us. Now, those of you who spoke about touch and care, please tell us what you feel about it. How far is it applicable to adults? What can you take from these practices? Well. Well, quite obviously, but well, look. You threw me with your question. What might prevent us? It's an interesting question. That means that that we allow ourselves to do things with children that we wouldn't do with adults. That's what it. So that means that we have some that we are deliberately doing things with children without trampling on their rights. Well, whoever asked that question, and hello to everyone online. You've asked a very genuine question, and I think there should be continuous attention when you touch a child. It's a very quick and a very direct access to a child's body. Someone said this morning, 10 years ago, that children just gave their bodies up to you quite easily, but adults, they take the child's body too quickly. They take over the child's body too easily, to say. Today, for instance, a child is no longer obliged to go and kiss his grandmother. And we are moving forward in all that, but in all the care that we provide, with care, we have to keep that in mind. So the difference between children and adults is that you can do things to children that you can't do to adults, and that's where the question lies. Well, I interpreted it differently. I have a different take on it. Your saying is that when you're innovating, you're creating something with children, but can you afford to do it with adults? Because now I work with adults and I feel that I control myself. I don't play, I don't invent, I don't create, and I don't distract them. Because touch and care is, of course, it requires authorization both from children and adults, but you yourself have to allow yourself, and here I'm talking to those of you carers who work in mixed services. It's very difficult to take care of ages going from 0 to 95 years and to provide the same kind of care. You don't. Last 1.5 years I've been working with adults, so can I really afford to use these same approaches with children with adults as I do with children? And I would say yes, you can. Absolutely, yes, you can. I mean it. The other speakers, do you have anything to add? Is there something that might be easier to share with the adult world? Concerning music, during the first videos we made with babies, we had to go through parents before we gave the music to children. And for blood tests, we asked parents to hold the kalila, and they play the instrument while we do the care. So even if it's not a parent who's providing the care, it's the parent who's providing, getting the care, he's providing a means of providing the care. In our experimentation, I don't think it works better in pediatrics, but I think we have a lot of young adults, and I don't have very old people either. Old, I mean over 25 years of age, and that's 90% of the room. Very often we have young adults who come back to see us in pediatrics, and they ask, can we do it here because it was really good? Parents do occasionally. So we just, manage amongst ourselves. So you might be 18, 20, or even 30 years. It does you a world of good to do what you do with children. So age shouldn't be an obstacle. Age shouldn't put you off. Now the carers are saying no, because it's all about touch and consent. And then also whether you yourselves would be willing to do the same thing. And so we are pain agents in pediatrics. It's the fun of it. It's you're singing, and people say to us, this is fun, you play, you have fun, you have events, it's almost entertainment. It's almost as though it's a party for pain. Yes, it is a sort of party for pain, but it also animates the whole thing. That's what we need. We as carers, we need to renew and to do something different, because all that we do, it's tough on us, it's really rough, and so it's good for us as well. So what might be missing is this distraction if you can't do it with adults.
voilà, laisser libre cours un petit peu à notre imagination dans ce
So you're
domaine.
saying that we can all afford to let our imaginations run wild, particularly for these grown-up babies, these adults and teenagers who might have some problems. Is there anybody in the audience who wishes to ask questions? I think we have to stop the session now. Right, there's a coffee break.